يلا you will be talking to Mrs. منى mother of علي.
اوكي
She's 10 months of age and
طيب
he is
جود
having. لا صفية صباح الخير، فكرتك سيناريو تاني. عسل، ركزي يا صفية، انت اللي فات. يلا you will be talking to Mrs. منى mother of علي. He's 10 months of age. He is here in the emergency room with broken right arm and this is his third fracture in his life. Please talk to her. Amin, you got 3 minutes.
Good afternoon.
Hello, good afternoon.
Dr. Safia, one of the children doctors working here.
Hello, nice to meet
I
you.
believe I talked to Mrs. Mona, mother of Ali.
Yes,
Nice to
that's
meet you
me.
too. Mrs. Mona, I'm here today to talk about Ali, and I will take some notes, and if you don't mind, I will write my note down. Is it suitable time for you?
Yeah, it is, it is.
Good. So, Mrs. Mona, can you tell me what is your main concern?
My child is having a broken arm, obviously.
Sorry for that. Right or left?
Honestly, I don't remember. They called me, I was working, and I just arrived here.
Okay. Can you tell me what happened before this his arm?
I don't know. I was not there. I was working.
Okay. And who took care about him at that time?
His older sister.
What is her age?
I guess like saying it's strange.
So, do you know what happened exactly? From where he fall?
I don't blame her. Doctor, she's just a kid. She's doing me a favor, taking care of her brother, so I'm not gonna blame her for what happened. That's rude.
Of course. Just I'm asking to know what happened exactly. So, sorry?
Whatever, بغضت عليك.
Okay. So after this broken of his arm, what happened? Can you tell me?
She called an ambulance and she is here.
Okay. This is the first time to happen for him fracture or a broken?
No, I don't know what's happening to him, doctor. Because this, I guess, it would be his third or fourth fracture.
And all other fracture from by similar or a similar scenario or there is different scenario?
I don't know. I don't remember, doctor. I have a lot of kids and I have my full-time job. I cannot pay attention to all these details. Don't you agree with me?
Okay, I'm agree. I can see. Mrs. Mona, do you have any other concern?
No, I don't have other concern.
Does Ali had any chronic illness?
If he considers this repeated fracture chronic illness, then he does.
Okay. When's the last fracture for him happened before this time?
I really cannot remember. It happened in his lifetime, you know.
And that from trivial trauma or strong trauma?
I don't think it's strong trauma.
Okay. Is Ali had any repeated bug in the chest?
No, I don't think so. Luckily, he had good immunity. Good immunity, but bad bones.
Okay. Did you feel any heart racing?
No, I don't think so because I'm not crying him that much.
Okay. Did you notice any weakness in any part of his body?
No, I didn't notice that.
So I mean, he moved his arms and legs freely.
Yeah.
Is there any widening of any point of any joint in his upper limb? I mean,
I didn't get the question.
is there any deformity in bones in his upper limb or
he's
lower?
having swelling in his wrists.
Okay. Is there any joint, other joint pain or other joint swelling?
No, maybe the ankles. I'm not quite sure. I'm sorry.
Any abnormality in leg bone?
Oh, doctor, I'm lost. I don't know.
Okay, sorry. Did you notice any skin rash?
In rush, he has horrible diaper rash. I guess his sister is not changing his nappy frequently. Despite that I told her 100 times, change his nappy frequently. But honestly, I cannot blame her. I'm not getting her any new nappies. Yeah, you know, the economical crisis has affected everyone in my family.
Yes, I can understand. So, any rash apart from this diaper rash?
I don't know.
Okay. Does Ali had any bleeding from any side of his body?
I don't think so.
And what about his eyes? Is there any redness?
No redness, I think.
Any fluid discoloration in the eye?
I don't think so.
And what about his hearing? Any concern? He's following you well regarding hearing?
I guess.
Okay. Can you describe his bowel habit for me?
I don't know. I'm not around a lot.
Is there any constipation?
You didn't hear me. I told you I'm not around a lot. I really don't know.
Okay. So, how many diapers per day he use?
I don't know.
Okay. Is there any history of trauma apart from that you tell me? I mean,
maybe. Yeah, maybe.
Okay. You travel anywhere recently?
No, I cannot afford that.
Any test done for Ali recently?
No.
Regarding this, his fractures, I mean the the previous two fractures. What was done for him?
Costs?
Sorry, cast.
Cost, yeah.
Why is that fracture? Why exactly?
I don't remember. I'm sorry.
Okay. Any admission?
No.
Okay. While you are pregnant with Ali, do you have any concern during pregnancy?
I didn't want him. I didn't want him. I wanted to abort him. I took the pills, but he was sticking in there.
Sorry, I didn't get what you
I
told.
just tried to abort him and it did not work out. That's what I want to say.
Okay, okay. You take any drugs at that time?
Yeah, I tried to drug him to abort him with drugs, but it did not work.
May I know what is the cause, Mrs. Mona?
I didn't want him. It's personal. Well, are you judge me? Are you going to judge me? Are you the police?
At all, at all. Okay, Mrs. Mona. And does Ali came term in?
I didn't know. I was not counting.
Okay, you deliver him normally?
Yeah.
The heel test is done for him?
I guess.
Okay. He need any admission after or any intervention after labor?
No, I don't think so.
Okay. Can you tell me now Ali can throw the object? If you give him something in his hand, he throw it?
No. He cannot do that because if he did that, I'm going to punish him.
Okay. He know to say bye-bye?
I didn't say bye-bye for him.
Okay. And when he look for you, he said mama, and he know how to say dada mama?
His dad is not in the picture, so I don't know if he can say that or not.
Okay. He start cruising?
What is that?
Around furniture?
I don't think so.
So he sit without support now? He can sit alone?
4 minutes. I'm not aware of that. I am not following him milestones.
Okay. Does he receive his shots according to his age?
Yeah, do you think I'm a bad mother?
No, just I want to be sure that
يا راجل ما تعلقيش. I'm really sorry you got this impression. دي bad وباد وباد. ده الباد نفسه هي.
okay. So does he receive his shot?
Yeah, do you think I'm a bad mother or what?
No, I'm sorry you get that impression. what feeling خلاص قلت لي ما عارفة عنه حاجة. Okay, anyone take his weight and height and head circumference?
He has big head, I would say that.
So, big head.
Yeah, very big head.
Okay, anyone take the measures for him?
No, I noticed that he got big heads.
Okay. So can you elaborate for me about his feeding mode? I want to know his milk or taking other foods like that.
No, he just breastfed, doctor, and I'm expressing my breast milk and give it to him.
Okay, what other food he received?
Only breast milk. Why he have to receive another type? I don't get it.
Okay. Can you describe your home for me?
It's a good aviated place, but it's not really big. I mean, we have only 2 rooms. I live in one room by myself because I'm the mom, and the other kids, which their number is 7, and a kitten, they are living in the other room.
Okay. Is there the good exposure to sunlight at home? And Mrs. Muna. Hello?
بالظبط ايوه
هو عمره كام يا صفيه قبل ما تيجي دكتوره فيولا؟
طيب طلعوا عندهم غرفتين وهو 7 في غرفة واحدة. Okay. So what you are doing for living?
Okay, I'm working really hard. I mean, I'm working like 4 days a week, and I'm working in one of the, the cruises. So I travel a lot.
I'm sorry. So we will raise this concern to try to help. Okay, Mrs. Muna, is your income satisfying you and your family?
No, of course, it's really difficult.
Sorry. So do you have any emergency access?
What do you mean by that?
I mean, easy way to reach to the hospitals?
Yeah, we can call an ambulance. Not a big deal.
Okay. What is the effect of his condition of Ali in you and your family?
It's really difficult to see him having this repeated fracture. But I'm also having problems because it's affecting my work. This is another problem.
Okay. Okay, Mrs. Mona, can you tell me about the opening in his top of his head? Is it widening or bulging, or did you notice any difference?
I didn't notice any difference, doctor. Your time is over. Present your case.
Today I take history from Mrs. Mona, mother of Ali. He is 10 months old. He's presented with history of fracture in the arm, mother mature right or left, with the past history of similar condition 2 times, last one with treated with by cast. Also, Ali had a big head and widened anterior fontanelle, and he had widened wrist. Regarding his nutritional status, only he take breast milk, and the one who take care about him is his elder sister, which her age is 10 years. He had also a diaper rash, and the mother is working hard work according to her. And so putting all this together, this is a case of multiple fracture or repeated fracture for differential diagnosis.
What's
Most
your
probably. أنا بس الموضوع النجلكت ده ما عارفة أجيبه كيف في السيناريو. There is a.
We are speaking in English here. What's your differential?
My first differential is rickets, and my second is non-accidental injury, and also it could be osteogenesis imperfecta, and
Okay, is he taking vitamin D drop supplementation?
I forget to ask.
Is he exposed
Yeah,
to the
milk.
sun?
I
Milk,
asked,
he's
but
taking milk. Did you ask about vitamin D supplementations?
no, I didn't ask.
You didn't ask.
And
And did you ask whether he's exposed to the sun or not?
I asked you, but you didn't. Either you didn't hear or you didn't answer me.
If I didn't hear. So, what do you think this is?
This is case of mostly nutritional rickets because no family history of similar condition.
Nutritional rickets. Okay, and not non-accidental injury.
Could be non-accidental injury.
Okay, tell me, how would you manage the child's condition, please?
Okay, first of all, we need to admit this patient, and we need to involve the social service, and then I will do for him full examination. I will do CNS examination, searching for any signs of increase in intracranial pressure. I will do for him full MSK examination, searching for any callus or any other fractures, old fracture. I will take his vitals and psychometric measures and plot in a chart, and I will involve my senior, and I will run for him some tests. I will do for
Did
him.
you say you will admit him?
Yes, I will admit.
Why?
Because of suspicion of non-accidental injury.
Okay, and if you're suspecting non-accidental injury, what else you're going to do for him?
Yes, I will involve my team, the social worker and the safeguarding, and we will regarding investigation. I will do for him in this age skeletal survey, and I will do for him CT brain. CT, yes, skeletal
Why you
survey
do
and
CT
CT.
brain?
Okay, I will do skeletal survey.
And you will not do CT brain?
I will do CT brain because his age is less than 1 year, so maybe there is suspicion of any bleeding in the brain or any non-accidental injury. So I need to be sure. I will do CT for him and skeletal survey post.
Okay, continue. What else you will do?
Okay, I will do for him a bone scan and X-ray for the wrist, and I will do. I'm searching
What are
for
you
widening,
expecting in the X-ray of the wrist?
cupping, fraying, and widening of the wrist.
Widening of
And
the
I
wrist.
will,
What does it mean? What do you mean? Widening of the wrist.
the space between the widening I see by my. Yeah, I will see cupping and fraying.
Cupping and fraying of what?
The distal part of the tibia and fibula.
So why
the
didn't
wrist.
say that?
I will do for him also a bone profile. I will do calcium, phosphorus, and vitamin D level, and I will do a
What is
thyroid
this
hormone level.
his calcium profile is going to be?
Calcium profile will be normal or low.
What is a normal or low? You are telling me this calcium profile is normal or low. What does it mean?
You mean calcium only? Calcium may be low.
I asked you about the finding of the calcium profile, doctor. My question is clear.
If this nutritional history, I'm suspecting low calcium, high alkaline phosphatase, high parathyroid hormone, and low vitamin D.
Okay, low calcium. What other types of rickets you know?
Maybe there is a type 1 dependent rickets and type 2 dependent rickets.
Do you think this case may be type 1 dependent rickets?
Type 1 dependent rickets, there is a. In type 1 dependent rickets, there is a problem in the receptor. Huh?
You tell me. You are asking me. I'm the one who's asking the questions here.
This problem in the receptor. So we will found vitamin D will be high. Active form of vitamin D will be high. 125 hydroxycholecalciferol it will be high.
And
Calcium will be low and phosphate low, alkaline phosphatase high, and parathyroid high. It
okay,
could be
doctor.
also
Okay. Are you going to do anything else for this family?
for this family. I will involve ده اللي يجيبوا لهم منه دي الناس I will involve social worker and I will involve ده اللي نجيب لهم الكامس، بس أنا ناسية اسم الكامس ليش. child بس هم دي الكامس. And also we try to support her financially and socially.
What are you going to do for the kid that she's taking care of her brother?
Yes, we need to involve a multidisciplinary team regarding that. We need to involve the social service to help her in this condition.
And what?
She need multidisciplinary team. She need educational team. She need dietitian. She need.
I'm waiting.
المشكلة.
What about the other kids? There is a word I want to hear. Checking for the safety of the other kids. Why the other kids are not going to school?
Am I right? هم safeguarding ولا منو? I will register them in
I don't care. I don't want the name. ما عنديش مشكلة. I don't want any name. But I want to check for the safety of the other kids. Okay. دكتور صفية لا احنا طبعا I cannot blame you after taking 2 scenarios in a row. Totally you would be distracted a little bit. But you did not prepare a good differential before you started taking the scenario. Am I correct? Am I diagnosing the problem correctly?
هو أنا خديت إن أنا accidental أول واحد لأنه features وبعدهم خديت من الفيتشرز الجات دي.
You did not accidental entry but you didn't ask questions. You asked
ما هي
مالها ما هي زي الفل.
هي أي سؤال أسأله ما عارفة الهيستوري كله بالعافية أنا قادرة أخذ.
Yes, this can happen. Yeah. Why? Because you are giving marks based on the questions you are asking, not on the answers you are getting there. It's a very common trap for everyone. Sometimes I ask you, why you didn't ask for this or this or this? Oh, she doesn't know any answer. I totally agree with you. She doesn't know any answer. But you are given marks based on the question you are asking, not the answers you are getting. Please keep this point in your mind. It's very, very, very important. Okay, so how I would do this scenario. So what I would say here, you are missing some questions. Some questions in the non-accidental injury. Some questions related to the rickets. Some questions related to the osteogenesis imperfecta. Okay, how I will overcome this? Number 1, studying. Number 2, by having a good plan before I start. So this is what I want you to prepare in your mind before you start. Okay, think Safiya, what this could be. Yes, you said to me, it can be rickets, right? It can be non-accidental injury. And it can be what? It can be osteogenesis imperfecta. Okay, so if it's rickets, what are the questions you should ask? I'm telling myself, I didn't start any scenario. Okay, if it's rickets, I need to ask number 1 about the head size in the measure. About the dentation, started dentation or not. Also, I would like to ask about the wide fontanelle. Fine. And the bowing of any legs and arms, any swelling in the wrists and ankles, and maybe family history of the same condition. And if he's older child, I may cover the renal and the blood pressure just in case it's renal rickets, but not in this age. Are you with me?
Yes.
Okay, so I hope I'm not missing anything. Non-accidental injury, I have to ask about that. Sorry?
التومي سايز في الريكتس وفي exposure to sun وفيتامين دي.
This is a nutrition. Yes, I agree with you. But tummy size, at this age, not really suitable. Again, مش هيلحق يبقى told this liver and spleen. But I agree with you about the nutrition and vitamin D and sun exposure. Non-accidental injury. What I should keep in my mind? I should keep in my mind bulging fontanelle. Absolutely. Also, if there is any throwing up, fits, or seizures, and can he move his arms and legs freely? Osteogenesis imperfecta, yes, dentation, bowing is also questions. I have already mentioned that. But it's very important to ask also about if there is any discoloration of the whitish part of the eye. This is what I'm preparing for myself before I start the scenario. So when I start the scenario, I have a plan what to ask. So he's having a fracture. It's an episodic event. So we have onset, cause, duration, what make it better, and what make it worse. Sorry يا جماعة, I got distracted.
دي اللي هي what happened after before it.
Yes. بس ساعات احيانا بتيجي لي كده رسالة في النص تعمل لي distraction. اوكي ده
الاوستوجينيسيس برضه ممكن اسال على لو ترانسبيرنتيز ولا لا.
I asked about the dentation. If you want to ask about transparencies, why not?
Okay.
So I will ask what happened before, what happened during, and what happened after. Alhamdulillah, she didn't give you any information. Right? Did you get anything from that? You didn't get anything. Never. So any other concern? No. Any chronic condition? No. So what I will do, I will approach the systemic review with this. Any repeated burn on the chest? Okay. When you carry him, have you felt his heart is racing? Can he move his arms and legs freely? Any fits? Any abnormal movement? What about the soft spot on top of his head? And I'm pointing. Is it wide? Have you felt anything abnormal? Bulging, for example? Okay? And then describe his mood for me. Why? Because sometimes the children is irritable. It has two problems. When the child is irritable, it puts him at risk of developing shaking baby syndrome, and he may be irritable because of the shaking baby syndrome. So I have to ask about the mood. Then MSK. Have you noticed any bowing or any deviation in any bone? Okay, what about his wrist and ankle? Okay, these are start these things. Describe it for me, please. And then I will move. What about his bowel habits? What about his pee? Describe his tummy size for me. This is a routine question. And if he's older age, I would say any frothy pee and any change in the color, anyone measured blood pressure. So this is what I mean by adequate preparation. Is it clear?
Yeah. Yes.
Okay, so let's continue. What else I should do? I will go to the past history. Okay, ma'am, you don't know about this trauma. Can you describe for me other if there is the previous fractures? What happened at that time? Can you tell me, please? I don't remember. Okay, what happened for him in the previous fracture? And did you do any test for that? Was he admitted? Operation? Then I should take the perinatal history in full detail. Why? Because it's 10 months. So it was taking perinatal history. So during pregnancy, what happened? Is there any follow-up? She doesn't even follow up. I mean, she doesn't even have the prenatal care. This tells you what she's a horrible mom. Did you do the screening test? Then feeding habits. Is only breast milk. طب what you are doing?
سوري هنا المفروض اسالها زي ما سالتها انه why she want to abort the baby ولا لا ولا
No,
ما
it's none
اسالها
of your business.
Okay.
Okay. Then she's breastfeeding him only. What she told you she's traveling. What are you doing when you're at food? How you are feeding him? Maybe she's storing the breast milk in the wrong way, right? What about his measures? His weight and height and his head size? Did he receive all his shots? And then you will ask about development. Now what he can do is 1 year, so he can clap his hand, wave bye-bye. Can he play peekaboo, for example? Okay, then how many words he's using? Is he using mama dada? Any stranger and anxiety? This question you have missed. And is he throwing stuff or casting stuff or not? After that, you will move to allergy, and then you move to the social and family history. In social and family history, you have to ask about family history of the same condition. Is he exposed to the sun or not? These are the important questions. Okay, Dr. Sophia?
Yes.
In any child I'm suspecting non-accidental injury, I have to do this, admit. Number 2, what I'm going to do, I will involve the consultant on call responsible for child protection.
Yeah.
And then number 3, I will examine him carefully, checking for any bruises. Okay, and I will take pictures for any lesions if possible. I have to match his screen shot detectively if something is weird. Anyhow, I will comment on the carer-patient relationship. And then for any child I'm suspecting non-accidental injury, I have to do calcium profile and coagulation profile. Any child less than 1 year, I have to do CT brain and fundus. Any child less than 2 years, I have to do the skeletal survey and repeat it after 2 weeks. This is the protocol I should follow for a child with non-accidental injury. Admit, involve the consultant on responsible for child protection. I will examine him carefully, taking picture for the lesions if possible. Commenting on the carer-child relationship, I will do calcium profile, coagulation profile. Less than 1 year, I will do fundus and CT. Less than 2 years, I have to do what skeletal survey and repeat it after 2 weeks. As I'm also saying, there are many schools that examiners are following. I mean, some examiner will tell you, consider it, for example, rickets. What are you going to do? Another exam, consider it, consider it osteogenesis. What are you going to do? This is one strategy. Another strategy the examiner is following. He's giving you this patient, throwing you away in the middle of nowhere until you manage the child condition. So what you will do in this case? As we said, I did that follow-up, or I did the protocol for the child protection. Then I will continue examining him, searching for features of rickets or osteogenesis imperfecta, like Marfan sign, like broadening of the wrist and ankles, rachitic cruzaris, and maybe I will palpate his abdomen. These are the examination. And then I will look at the whitish part of his eye to see if there's any bluish discoloration. And I will take vitals, anthropometric measures, involve my senior, if needed, my consultant, and I will do some tests. Absolutely, X-ray for the fracture was done, and the orthopedic had been involved to do the cast. So what you will do, I already did calcium profile. This is what I tell the examiner. And according to the result, I may proceed. And if the calcium profile is non-conclusive, I have to do 24-hour hydroxyproline in urine with genetic testing to search for osteogenesis imperfecta. At this moment, the examiner is obligated to tell you about a certain diagnosis to follow. Why? Because this is what happened in real life. At the investigation, you reach where you are exactly. Clear? Are you with me so far? Okay. Now let's talk about osteogenesis imperfecta because it's shorter. As I have said, I'm doing genetic 24-hour hydroxyproline in urine. That's it. And orthopedic surgeon and the advice will be given: avoid trauma, minimal handling, follow up his hearing, etc. But let's talk about the rickets. How many types of rickets do we have? Can anyone tell me?
5
لا
ولا 7
كده نزل. Sophia,
dependent to
I don't want its names. I want the number. How many types are they?
chronic kidney ولا بسنجة سكاتي 7
طب عشان خاطري
7 عشان خاطرك 8
ربنا يخليك. Yes.
عشان باراتيرويدزم ولا هناك خلاص 9 طيب
Okay. We have here X-linked kidney, and then we have hypoparathyroidism, and then we have pseudo hypopara. يعني pseudo is really extremely rare. I will not discuss it. And Sanjit Sakati. Only one pseudo is enough. Okay?
Yep.
Here in the history, I will talk only about the investigation. In the clinical, we will talk about how to differentiate them clinically. I'm going to say one word, only one word, okay? About each of them, about the pathophysiology. This word will help us to know what is the calcium profile picture. In nutritional rickets, what's happening? He's not eating, so decrease vitamin D intake. Vitamin D dependent one, there is a problem in the activation. Why? The 25 hydroxy vitamin D is not activated to 1 and the 25 hydroxy vitamin D. Vitamin D dependent 2, the problem is in the receptors. Meaning what? Receptors of what? Receptors of vitamin D. The child is eating, he's exposed to the sun, the vitamin D is already activated, but the receptors of vitamin D is broken down, but it is not working. It's like it's hypophosphatemia. Kidney, we have two problems in the kidney, which are, let me just admit our colleagues, which are, the first problem in the kidney is retaining phosphate. Retaining phosphate, so instead of excreting it, and instead of getting rid of it because it's harmful, it retain it. The second problem is that activation, one of the steps of the activation occur in the kidney. Hypoparathyroidism, it's normal. Hypoparathyroid hormone. I mean, I want to say it's not complicated yet. So hypopara, I have plenty of PTH, but it is not working because the receptors is not working. Sanjit Sakati, it's a case of a syndrome, submental, having some endocrinal abnormality. One of them is decreased the parathyroid hormone. Is it clear?
Yes, Dr. Clear.
Okay, so based on this, let's discuss the features I'm expecting to find in the calcium profile. And let's tell the story. What happened in nutritional rickets? In nutritional rickets, the child is not eating, he's not exposed to the sun. So vitamin D will decrease. As a result, the calcium will decrease. As a result, who got upset? PTH. And it leads to 2 points. It increases the calcium one more time and kick out the phosphates. Let's agree that alkaline phosphatase is anyhow high. So the end result of this story is decreased vitamin D in active and active form. Parathyroid hormone is increasing. Phosphate is decreasing, but the calcium is normal or relatively decreased. So despite this is rickets, but the calcium is normal or relatively decreased. Why? Because the PTH increased to increase the calcium. You said it wrong, Dr. Safai. Okay, are you with me?
Yes, doctor.
Okay.
Yes.
What about vitamin D dependent one? We said the problem in the activation. Pay attention to the table here. The 25 hydroxy vitamin D is normal, but 1 and the 25 hydroxy vitamin D is decreased. So the active form is decreased, and the same sequence happens. What about the vitamin D dependent 2? And vitamin D dependent 2, look at the active form of vitamin D, it's really high, but the same sequence of events happen as well. X-link it, we said we have one problem, hypophosphatemia. Renal failure, remember, we said 2 problems. What is the problems the renal failure have? Number 1, the kidney got crazy. And instead of excreting the phosphate, it retained it. The other problem is in the activation of vitamin D. And the same sequence actually happened. What about hypoparathyroidism? If this is the screen. If this is a PTH, if it's decreased, so the calcium will decrease, phosphate will increase. In pseudo-hypoparathyroidism, I have excessive PTH, but still low calcium and phosphate is high. Is it clear?
Clear, Dr. Yes.
Okay, so based on that, I can memorize the calcium profile picture without أنا أظن من غير ما نحفظ. We know from where this is coming. But imagine كده with me, the examiner told you, okay, manage the case as if it's rickets. What are you going to do? So I would say I would do investigation to confirm it's rickets, investigation to figure out what is the type of rickets, and investigation for the association and complication. How to confirm this is rickets? The most and the early sign to appear is the wrist X-ray. And here, Dr. Sofia, I want to give you an advice. You are telling me cupping a frame. Cupping a frame of what? I mean, you know the answer. So why you don't say it complete without any promising? Am I right here?
Yes, but I said I will do X-ray for wrist for cupping and fraying.
Cupping a frame of what? Of the carpal bones? Which carpal bones is present in the wrist as well?
Okay.
Right? You have to be specific. Cupping and fraying of the distal end of the long bones. Widening of what? Widening of the joint space. Osteopenia, green stick fracture. So again, cupping of the distal end of the long bone. What is cupping? It looks like a cup. What is fraying? I mean, instead of that, it's like that. مش هالشرط. Of the distal end of the long bone. Widening of the joint space. Osteopenia, green stick fracture. And sometimes they do DEXA scan and the skeletal survey. What is the difference? DEXA scan, it tells us about the bone density. The skeletal survey, it tells us about any fractures. To know what is the type, I have to do calcium profile, association and complication. For example, I have a case of Sanjit Sakati, so I have to do insulin growth factor 1. I have a case of renal rickets, so I will do the albumin creat ratio, RFT, as well. Did I finish? No, I have a lot of things to do. Number 1, I have to make sure the other children are safe. This is number 1. I have to make sure why the older child is not, I have to check she's not going to school. And also, I will give the mother advice about the right weaning procedure and about the importance of exposure to the sun and avoid trauma with minimal handling. Clear? Any questions?
Yes,
تمام يا دكتور.
Okay. We'll do next.